Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Feeling sluggish, gaining weight, is it your thyroid? That is always the question to ask yourself. And I always encourage people to go and have a comprehensive thyroid blood test done, where they look at all of the different thyroid hormones, because this is critical to how you feel each and every single day. And I'm going to get into the details on that on today's episode. I am Amanda Williams, MD, MPH. And what do we know about the thyroid? Well, we know that the metabolic rate of every single cell in the body is controlled by the thyroid hormone. In particular, when we think about T3. And T3 is your active thyroid hormone. Generally speaking, when you go to the doctor, they just look at TSH, which is the thyroid stimulating hormone. And this is produced in the pituitary gland. Now, T3 is also important to look at, because if we're not making enough T3, or if we're making too much T3, we need to actually know what these levels are. So that's why I always say comprehensive thyroid testing lets you know what is actually going on. And it's very common for people to have suboptimal thyroid function that can contribute to issues such as weight gain, such as feeling fatigued. The problem is if you have suboptimal thyroid function, nearly 10 out of 10 doctors are not going to recognize that. But it doesn't mean that you are not feeling the negative impact of this. So this is why I always encourage people to have all of those levels looked at, so it can give you an idea as to what's normal for you, because what might be normal for the lab range may not be normal for you. And this is very important, because when we look at, just hypothyroidism, for example, we know that this is pretty prevalent in this country. Probably about 5% easily of the U.S. population has hypothyroidism. And the symptoms that go along with hypothyroidism obviously include things like feeling tired, weight gain, dry skin, hair loss. You can get muscle cramps, just across the spectrum. And think about why that is. Because remember, the thyroid itself is regulating the metabolic rate of every cell in the body. So you can see how the thyroid, when it's not working properly, is going to start to make you feel cruddy all over. Now, we know that there are certain nutrients that the thyroid must have in order to properly disperse itself. So when we think about the pituitary gland, we have thyroid stimulating hormone, and then we have to have things such as iodine and zinc and selenium and iron and magnesium, vitamin E. These are all things that we know that the thyroid is heavily reliant on in terms of being able to make that active T3. And if we don't have adequate amounts of selenium, the amino acid tyrosine, this is a huge one, and iodine, this is going to be a problem. Because remember, we're regulating metabolism throughout the body. We are obviously dealing with temperature regulation when we're dealing with the thyroid. But also remember, there's a strong connection between all endocrine glands. So if we have one glandular system that is kind of gone off the rails, it's going to start to impact other. So we can see the adrenal connection. We can see the connection with pancreatic release of insulin. So many times when people have subclinical hypothyroidism, they present with this whole multitude of different problems. And we know that when it comes to subclinical hypothyroidism, even the American Family Physician Journal back in the early 2000s estimated that 20% of women over the age of 60 suffer from this, from subclinical hypothyroidism. But yet they're just told, oh, well, it's because you're going through menopause. Well, no, that's not why. It's because my thyroid is not working properly. This is such a critical thing that is so commonly overlooked. And I've seen it year after year when I look at people's blood work, and I am always sitting there scratching my head saying, well, how is it that that your doctor hasn't picked up on this? But because if it's not within that range and it's not flagged as abnormal, they will not look at it. When we think about all of the different nutrients that we know Americans are deficient in: magnesium, omega-3 fatty acids, zinc, vitamin D, all things that the thyroid needs. I mean, zinc in particular. Zinc is essential when it comes to the thyroid. So we have the thyroid releasing hormone coming from the hypothalamus, then we have the thyroid stimulating hormone from the pituitary gland, and then from the pituitary gland we get that conversion into T3 and T4. So this is the stages of the different thyroid hormones. Now, if we do not have zinc to release thyroid releasing hormone, then the thyroid's going to be sluggish. But they never look at thyroid releasing hormone. That's not a common thing that they would ever test. But we definitely know that zinc is required for proper functioning of the thyroid. And we know that probably 40% of Americans have a zinc insufficiency. It means that you're technically not deficient, but you certainly don't have enough. So we start to look at all these different factors and we say, well, what is it that we can be doing? Well, first, we need to know what's actually going on. Because even in the journal Lancet, which is a huge, huge journal, they looked at TSH levels. Now, as I mentioned, this is the most common thing that they are going to test. So if you go in for just a standard annual physical, the doctor may run a TSH test. Now, the labs in this country run that range from anywhere from roughly 0.5 up to 4.5. That's kind of fairly standard. And so unless your level is above 4.5, they're not going to flag it as being hypothyroid. But what we know from the Lancet journal and all of the studies is that TSH levels that creep above 2 actually are an indication for an increased risk for developing hypothyroidism. It's an increased risk. So we know that TSH levels that are falling between 2 and 4 are generally directly associated with having high cholesterol. And we know that TSH levels greater than 4 certainly are going to indicate to a doctor that, maybe we do have hypothyroidism, but it's also a direct link for a greater risk for heart disease. Understanding all of these different things and understanding that there are nutrients that we can be taking in, like the Thyroid HX, that contains iodine and tyrosine, and it has ashwagandha extract. Ashwagandha is an adrenal adaptogen, but it does so much to really support the thyroid. Remember I said that the different glands communicate with one another. So if we're helping to support the adrenals, we are in a sense supporting the thyroid. We see the same thing with rhodiola. This is a common thing that I turn to when people come in and they are complaining about not having good energy, feeling sluggish. Their thyroid levels look pretty spot on for being a subclinical hypothyroidism. Is we need to make sure that we can make energy in the body. So rhodiola extract is very beneficial for helping to heighten up the cellular energy production, at the same time helping to modulate the adrenal gland. So we've got rhodiola we can turn to the Thyroid HX that contains that iodine, That's coming from seaweed. We know that we need to make sure that we have zinc. We certainly recognize selenium. And these are required. I mean, you have to have selenium in order to convert T4, which is your most abundant thyroid hormone, into T3, which is your active thyroid hormone. We have to have zinc to have that release of thyroid releasing hormone, but zinc also helps in that conversion of T4 to T3. Now, here's an interesting thing too. Iron. Iron deficiency or even iron insufficiency can reduce the activity of thyroid peroxidase. So there is certainly a correlation between iron deficiencies and subclinical hypothyroidism once again. And then the main amino acid that the thyroid requires is tyrosine. Now, tyrosine is derived from the amino acid phenylalanine, and this is needed for neurotransmitter production. So when we look at tyrosine and dopamine and norepinephrine, so we certainly know that there's many different things that can clearly go wrong when we think about that process, going from the hypothalamus to the pituitary into the thyroid gland itself. All of the ways in which the body can kind of have missignalings or not have enough nutrients in order to really do what we need it to do. And when this happens, then people come in and they complain. I have no energy. I'm gaining weight. I feel achy. I have low mood. My hair feels incredibly dry. My skin feels incredibly dry. I'm constipated. These are all common things that happen in that setting of subclinical as well as direct hypothyroidism. So hypothyroid is actually an underactive thyroid. And this is when our thyroid gland is not producing normal amounts of those hormones. And we know that we have a huge amount of people in this country who have hypothyroidism, and they're taking different medications. Most often they're taking Synthroid, which is levothyroxine. Now, here's another interesting thing when it comes to that. There are people who have been on thyroid medication for maybe 15, 20 years, and their doctor has never adjusted their prescription level, which doesn't make sense because when we think about the thyroid, we're talking about a hormone. So we're going to have fluctuating levels, which means, maybe the amount that they started you off with, initially with your Synthroid, may need to get adjusted over time. You may need more, you may need less. And they've actually done studies where they show the ineffectiveness of not being able to actually follow up. They did a study and looked at the adequacy of thyroid hormone replacement in the general population. And this was done over at the Prince Charles Hospital in the UK through their endocrinology and diabetes department. And they just wanted to see the prevalence of how many people who were on levothyroxine, aka Synthroid, how many of them were on this medication, but it really wasn't doing anything. And they assessed over 1,000 patients, the majority of those being female. There was 86% of the people in the study were females. And they found that like 40% of these people were getting inadequate replacement. And it was an equal split. About half of them were getting too much levothyroxine, and about half of them weren't getting enough. So what's the point? If they're giving you something and then yet they're not assessing this. I mean, we know here in the United States, that's the most commonly prescribed medication in the United States. You can look at all drugs prescribed in this country. The number one drug prescribed in terms of prescriptions written in this country is levothyroxine, aka Synthroid, with like 22 million prescriptions per year. That's an awful lot of people who are taking this. And out of those people, how many of them fall into that category of, hey, this is too much, or hey, that's not enough? But unless their doctor is really monitoring that, they're never going to know. So this is why oftentimes when people are told that they have thyroid dysfunction, they just kind of accept the fact that they have a hard time with maintaining healthy weight, that they have a hard time with feeling like they have energy, that their skin always feels dry, and they just accept it. And then we can take it a step further and we can look at, the autoimmune components to this. So we have Hashimoto's, then there's, thyroiditis, which is inflammation within the thyroid, and this is brought on because of a overactive immune system. So looking at the proper antibodies is always very important. So looking at the thyroid peroxide antibody, looking at the anti-thyroglobulin antibody, very important. So if there's an underlying autoimmune component to it, we always want to assess our vitamin D level. We always want to look and see what are those antibodies actually doing. If they're really, really high, we know that the immune system is really, really ticked off. So all these Americans have thyroid dysfunction. And we know that women are certainly more likely to have this than men. And as I mentioned, it's, more and more common that, women are just told, it's because you went through menopause. But yet they have subclinical hypothyroidism. So we want to make sure that we are doing all of the things that we can to really optimize normal thyroidal function. Making sure that the body can do what it is supposed to do when it comes to converting from TSH to T4 to T3. So taking in those nutrients on a regular basis. Making sure that at minimum we're taking a multivitamin that's going to give us at least a little exposure to magnesium and to zinc and to that selenium. Obviously, if you know that you have a subclinical hypothyroidism, then it can be much more targeted towards your specific needs. If you are finding that the weight is your biggest problem, then, making sure that you have targeted nutrients that are going to really help to optimize that thermogenesis, that natural fat burning in the body. If your issue is you just always feel tired, maybe you're not sleeping good because the thyroid's impacting your sleep cycle, then utilizing things such as rhodiola would be beneficial. So all of these different nutrients can be used to give you comprehensive support when it comes to the thyroid. So just as kind of basics, just as an overview, the Thyroid HX, very good option. Taking 1 capsule twice a day. Taking rhodiola, 1 or 2 capsules per day. Taking a multivitamin. I would probably go with the Performance multivitamin because once again, it's going to give you some additional rhodiola along with superoxide dismutase, so to fend off oxidative stress that may be occurring because of that sluggish thyroid. Making sure that you have your blood levels tested to see if there is any type of iron deficiency occurring. Because if that's the problem and the thyroid is struggling to make active thyroid hormone because you don't have enough iron, then that's a very easy fix. But you have to know these things by doing comprehensive testing. So it's not like just go in and just see the doctor once a year and they run a CBC and that's it, and look at your cholesterol. They have to look at my iron, look at my ferritin, look at my vitamin D level, look at my TSH along with my T3 and my T4. And make sure it's the free form. So free T3, free T4. Looking at your B12 level. And these are all things that can give you a lot of insight in terms of the way that you are actually feeling if you have either full-blown hypothyroidism or subclinical hypothyroidism. Remember to always reach out to any of our nutritional experts at any of our locations. They can certainly help give you that guidance when it comes to selecting the appropriate nutrients to target whatever concerns that you may have. So I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram. And we will see you next time for another episode of the Invite Health Podcast.